Thank you. Thanks, Rabbi Top. Thank you to Rabbi Posey. Thank you, Jacob, for organizing tonight and for bringing some attention to really an incredibly challenging issue. What I'd like to do over the next hour is first to introduce everybody who's up here. We have some very different perspectives and talk about, get some unique perspectives, and then talk about the issues both as they are manifesting in our society at this moment in time and in our community. I'll say a quick word just to give you my perspective. By training, I'm a healthcare lawyer. Normally, people like me are reviewing contracts and giving advice on very kind of removed topics not involved in healthcare. And the journey for me into this work has been a little bit surreal. And I wrote a book, as Rabbi Top said about it, just to share with you. In the middle 2000s, because I was working with a lot of doctors in trouble. Many of them were actually doctors who got addicted to the drugs we have today in hospitals and in healthcare are so powerful that many of these doctors themselves became addicted and got into addiction medicine. And I found myself doing crisis response in one celebrity death after another. One of the things I write about in the book is that when Michael Jackson died, I was called by several doctors who had prescribed to him under fake names, and one of the doctors tragically took his life out of in despair over what was going to happen to him as it became public, as the story became public. And I got involved in one after another of these stories, and that then led to work of started going into addiction treatment programs around the country that were having rashes of overdose. And we'll talk tonight about what's going on, but partly it was we're living in a time when the numbers of overdose deaths and suicides are just ratcheting up. And so I developed this bizarre specialty, but it made me feel strongly that there was critical work to be done, and I started doing a lot of work around the country on trying to improve addiction treatment and bring standards to it. And so I come to this work sort of looking at it a little bit higher up. I'm sitting up here and frankly humbled by my co-panelists, who I'm going to let introduce themselves so they can tell you the people who are much more involved in really hands-on in the front line of the work. And I hope that through the conversation tonight we'll get some insight into both what's going on and what we can do about it. So with that, I'm going to ask Gabriel Hershoff, who runs Aish Tamid, to introduce himself and talk a little bit about Aish Tamid and your work there and your perspective in coming to these issues.
Thank you. Thank you for having us here tonight. Thank you for all for coming. Nice to see that people are willing to have the conversation. Unfortunately, many people are only willing to have the conversation when it directly hits their home. But we don't have to look very far to find people that either have mental health issues or some form of addiction. So my name is Gabriel Hershoff. I'm a rabbi, social worker, and a substance abuse counselor. I run a program called Aish Tamid. I work with at-risk teenagers and at-risk young adults. We have a center and a safe place for young people to come in the evenings where we provide food and recreation, and more importantly, a place for people to talk to and a place to get support. Additionally, we provide support for parents, and we work with a lot of rabbis and teachers, and the best part is dealing with the kids' friends, the young people's friends who reach out trying to figure out how they can help their friends. So we're involved with different the age groups we work with is basically 15, 16 to 25, and it's a combination of make referrals and just provide support. Thank you.
Terrific. And so to Gabriel's left, I wanted to introduce Debbie Fox of My Child Safety Institute. And Debbie, if I can ask you also to just share a little bit about your background and the work that you do.
My name is Debbie Fox. Is this working? My name is Debbie Fox. I'm the founder and director of Magen Yeladim Child Safety Institute. And our focus is awareness, education, and prevention of child abuse. We do programs, basically school-based programs or community-based programs, going to communities across the United States, Canada, and Mexico, and bringing child safety on the level of speaking to school administrators, to staff members, to parents, and then we go into every age of children. And the goal is to make everybody aware, to give everybody a language for discussion, and to do everything possible to prevent victims of abuse.
Thank you. Donnie Sampson from Destinations to Recovery.
Hi, thank you, and thank you everybody for being here tonight. My name is Donnie Sampson. I'm the founder and president of Destinations for Teens, which is a teen treatment center located here in California as well as Nevada. We have 2 residential facilities treating dual diagnosis, which is substance abuse and mental health, and then a primary mental health house as well. Each of them has 6 beds, so a total of 12 residential beds for teens ages 13 to 17. And then we have 3 outpatient programs located, one in Woodland Hills, one in Mid-Wilshire, Wilshire and Preston Heights, and the last one is in Las Vegas. The outpatients have what's called a PHP program, or partial hospitalization. That is a day program which includes education, so they can continue their schooling while attending our program during the day. And then 6 hours of intensive therapy, which would include individual therapy, family therapy, as well as group therapy. And then in the evening hours we have, or late afternoon hours, have what's called an IOP, intensive outpatient. And that's about 3 hours, 3 times a week for the patients that come in for that. Why am I in this business and why am I here tonight? It's the passion for helping people, I think, runs in my blood. For all those who know my father and what he started in Los Angeles in terms of NCSY and helping youth, not necessarily at risk, but some of them were. And I think that I grew up in it, and being in healthcare. So it's important for me. And then one other side note, unfortunately, in my first year of college, I lost a friend to suicide. So I think it kind of hit home and said, this is something I really want to be involved in, knowing what happened to this individual. And that's why I'm here.
Terrific. So I'm going to come back to you, Donnie, just to give us an overview in a minute, but I thought it would be useful to share a little bit of background on the sort of scope of the problem, just some numbers. We talk a lot about the opioid crisis, which is really talking about the last 20 years of overdose deaths, of the issue of overdose deaths arise in the number of people with addictions, including substance use disorders, and a related problem of people in chronic pain who are using opioids. One of the most scary and fascinating things that came out this last fall from the University of Pittsburgh was that it's actually, if you look at all drug overdose deaths, we have a 40-year exponential curve in the country, going from the 70s of a rate of about 5,000 people a year dying in the early 70s to last year 72,000 Americans dying from all drugs, about 2/3 from opioids. So that's the overdose problem is what gets headlines. The addiction problem, just to give you some numbers to think about, 20 million Americans self-report as having some form of a substance use disorder, alcohol or drug, and we're going to talk about what broader ranges of addictions. That's roughly 1 in 12 adults in America, and it's one of the challenges we have is that only fewer than 2 million are actually in treatment, and a smaller number actually have a diagnosis, which is a problem with access to care. And finally, on the related problem of chronic pain, which seems to be tied in and a piece, not the whole story, but a part of the drug issue. The numbers are 20 million Americans report that most work or life activity is limited by chronic pain. 50 million say some life activity or some or most chronic pain most days. 20 million say that they are limited in their life and work every day or most days by chronic pain. So we're talking about just staggering numbers. 1 in 5 Americans thinking of chronic pain as a problem in their lives. And the reason I bring up the pain issue just to amplify that before I turn to you, Donnie, is that what we've seen in the last 20 years of the opioid crisis is that a problem where drugs marketed, painkillers that were marketed as prescribed drugs started a crisis, but once we became aware of the problem and doctors were educated and pressured to stop prescribing, the problem got worse because people simply turned to heroin. And then once heroin trafficking was limited by the government, people turned to fentanyl. And we're living in a time, if you look at the numbers, the curve is accelerating and the problem seems to be on a numeric level getting worse. So I just use those as an entry point, but Donnie, if I could ask you to talk a little bit about the kind of the range of addictions and the interplay between addiction and mental health treatment.
Absolutely, thank you, Eric. I just want to also add that addiction is an illness, and it is a form of mental illness. And one of the things that we have to all realize is it's similar to cancer, and we have to treat it like an illness. And it's important for everybody in this room and everybody in the world to understand that they can't just think that an addict is a crazy lunatic person and, we don't want to talk to them, and we want to help them. We should all be involved, just like we would help someone who's suffering from, I'll use cancer as the example. If a family member has cancer or someone or a friend has cancer, we get the community involved. That's kind of what we're doing here. We're trying to get the community involved to help people who have mental illness and addiction. So I just wanted to put that as an aside before I get into the details of the trends within, but it's very important to understand as a community that this is an illness and how to address it as an illness. I further want to say that it's 1 in 5 adults in America today suffer from mental illness. You had a little bit bigger number, or less of a number I should say, because 1 in 12 have the addiction side, but mental illness is 1 in 5 adults in the U.S. And those are staggering numbers. And the addictions can be varied, and I'll go through a list of some of them. And what Harry was mentioning a minute ago regarding the new drugs or the types of drugs that are being used, the trends in today's market for drugs is definitely heroin is very easy to get, it's very cheap, and it's very addicting. So for the dealers, it makes it very good for them, very profitable, but it's also very addicting to the users. Very easy to become addicted once you start. And because it is so cheap, it is very easily accessible. There are a lot of other drugs, as Harry mentioned, like fentanyl, that are more expensive, but can also be gotten by getting prescriptions for painkillers, etc. And people become addicted to painkillers due to the chronic pain, as Harry mentioned. But also, they're using these drugs, for the most part, as a coping mechanism. Whether it's because of the chronic pain, the pain might have gone away a year ago, but they're still taking medication. And they're using it as a coping method or a way to kind of go through the day with these drugs. Some of the other forms of addiction are internet addiction, which would include porn. That is a very big one that we're dealing with right now in our program. And gaming addiction. Gaming addiction is, if all of those who know anything about Fortnite, if you've heard about Fortnite, or any of the other games that the kids and adults, by the way, there are plenty of adults out there that have an issue with gaming. But, it's really the root of the problem is the mental health issue behind it. Most of the people that start an addiction have some form of mental health, whether it be anxiety, depression, abuse that was brought on to cause these problems, and that's where the teams specifically that I work with have developed the addiction component because of what's underlying in their homes, in their community, and I think that's really the trends that we're seeing is that it's easier to get, especially in California and a lot of other states that have marijuana is legal, THC, you can basically get it anywhere now, but it's the same as alcohol. You know, if you take one shot, it's okay. If you go into 5 or 10 and you do it daily, you're an addict. And you have to realize that you're an addict. And people need to help you if they see those warning signs. So I hope that.
So, yeah, I actually want to come back to those issues later. First, Debbie, in your work, I know you're focused on prevention and kids. I'm just wondering what your perspective is on the underlying issues that are driving this.
So, I actually called a bunch of mental health professionals in the Orthodox community before speaking today and asked everybody this kind of same question, and everybody's answer was the same. The area of greatest concern is trauma, is underlying most of these addictions. What kids or adults are suffering with is unresolved trauma. And I think what the focus needs to be, from my angle, is both prevention and how to deal with it. It actually was quite fascinating. I decided, because of the rain, that I would take an Uber here tonight rather than take my car. So this big white truck drives up. Now, I've never been in a big truck. I was as of today, and I'm quite tall, and I could barely get in there, and I get in there, and the guy asked me where I'm going, and I said, I'm coming here, and he goes, so what you going there for? So I said, I'm involved in a talk. So he says, what's it about? So I said, well, just addictions. So he says, can I talk to you a minute? That's why when I'm on planes, I never make eye contact with anybody. Anyway, to which he told me that when he was 9, he was molested by a cousin, and that he could never tell anybody because of the shame. By the time he was 13, he was addicted to marijuana and then to opioids. He became a heroin addict. By the time he was 15 or 16. And what he described that was so painful was knowing that he was living in this house with his mother, that he was going to school, that he had relatives, and that nobody saw the addiction clearly. Nobody saw the pain of the trauma. Nobody addressed the pain of the trauma. Nobody gave him words or an avenue or an open ear to discuss that trauma. And nobody really addressed the addiction. And how painful it was to live in this world with that experience. And that's the experience that I have in my office, is when people come and talk about that voice that has never had a way to be heard. Interestingly, with this young man, who looked like he wasn't more than 23 or so, what ended up happening was a grandparent took him in, a grandfather. And the grandfather said, I have 3 rules. You have to go to school, you have a curfew, and you have to go to church. And he said it was the first time anybody ever gave him a rule. And he loved it. And he kept it. And he went to church, and he had a pastor, and the pastor talked to him. And the pastor gave him a voice, and the pastor gave him an ear. And I really believe that that is what we need to be doing. I believe that the greatest prevention for abuse and the greatest prevention for addictions is the relationship with parents. That's what I would say.
So prevention, I want to come back and talk about prevention, but Gabrielle, I want to turn to you. You're really on the front line of what I think of as intervention in our community. And I'm just wondering if you can talk about your perspective, both about the underlying issues and about what that looks like. What are the solutions?
So I'm going to echo a lot of what Donnie and Debbie both said before, kind of mimicking a little bit what they said. Some of the issues that go on in school, in our Jewish schools, believe it or not, in our Jewish high schools and our Jewish schools, we're not immune to anything. The alcohol that goes on, the smoking, marijuana is all over the place. You don't smoke cigarettes anymore because it's out of style. but everyone else is smoking pot. You know, the anxiety and the depression that goes on in school is discussed, or you can almost see it on the kids. You know, the cutting, the pornography, and yes, the vaping. The vaping is the new one, is the new substance out there. And yes, Fortnite. Fortnite is a rather, parents call me a lot, and they say to me, my kid is playing Fortnite, I can't get him off the computer. Again, my belief is that the substance abuse is just a symptom. They're just self-medicating. They're self-medicating. Some people, you know, the girls are more into cutting and eating disorders. Not only the girls, but many of the girls, they do that, and the boys smoke pot and do other things, but it's all the same. They're all crying out. Again, there are young people that are just trying, experimenting, but those aren't the people we're talking about. We're talking about the kids that are basically dysfunction. They're not functioning. They don't go to school. They don't do anything. That's a lot of the clientele we have that just do nothing. They sit at home, and we reach out to them to try to engage them a little bit at an early stage. The other thing I want to bring up, you know, I brought a flyer, something I printed before. A lot of people call me that they say to me, you know, my kid's an addict, he's smoking pot, or he's doing, you know, there's a major difference between, there's a DSM. DSM is like I call it the written law of the mental health world. And, you know, addiction is part of mental health, but so is substance abuse. So there are many of our kids that are abusing drugs, but they're not necessarily drug addicts, right? I mean, there are plenty of people I've seen in rehabilitation programs. They go to rehab, they go for 6 months, they get help, they deal with the underlying issues, and they go out and they can still drink. They're still capable of going out. You know, I usually ask the parents, and they call me, and they tell me that their son is a drug addict and he needs to be admitted into a program. I say, has he ever stopped? Has he ever tried stopping to use? So us as parents, we want them to stop using, but if they've never tried stopping to use, then, addiction is about, using more than you intended to use, and the second is about using despite negative consequences. Right? Those are the two definitions, but there's a whole list, and I printed it over there and show it to you later, of all the different pieces in order to call someone a drug addict. But again, the difference between addiction and abuser, a drug abuser, and there's many, many drug abusers, but they're not all drug addicts. They don't all fit that criteria. You had asked me about, one of the questions were about, what we can do in schools. So, like for the future, like for our schools, a lot of the kids in high school, they get a lot of education from the media and from Netflix. And they all have watched these, TV shows about suicide, and it's become a discussion in school. So I'm a big believer that there has to be some form of education in school for mental health issues. It's prevalent to them, and they have to have a place to discuss it and share. Does that mean they all have it? No. But they have to have it. It has to be a normal discussion, because the information they get now is from elsewhere, from the media. And the last piece, which I think is crucial, is about reducing the shame and the denial in the community. People call the office, and their kid is isolating, and their kid is using, or whatever's going on, and he's out all night, and he's in trouble, whatever the pieces are, and they call and swear into silence, which we're mandated, of course, but often they don't give me their name, which is, I encourage people not to give me their name if they're not comfortable. But I say, I kind of laugh to myself. They tell me they live on, some street, Beverly Boulevard or something. They give me a name of the street. And, I figure out where they live, and I'm like laughing. I'm like, like 2 doors over, there's another person that has a kid who's they're also hiding him out in the basement. And then, 2 doors the other direction, there's, and what you just said a minute ago, it's about sharing. It's about, people that live in pain by themselves, the greatest thing you can do for them is allow them to share and accept them. And all the programs that, there's so many people here who run programs, looking around, psychologists and programs, they encourage support, right? Support. When I have support, I'm willing to share. I can walk into an AA meeting or walk into a meeting and everyone feels comfortable because they feel supported. As a community, we need to lower the stigma and be able to get support from each other. We're not the only ones walking around with these challenges.
To get your perspectives on is whether things are getting better or worse, right? I mentioned a few minutes ago the statistics on overdose deaths, so there's some signs that things are getting worse and worse in terms of the number of people affected. On the other hand, both on a national level with the inclusion of addiction treatment as an insurance benefit for the first time in the last decade, and in conversations like this, we're talking about these issues. So, Donnie, if I can start with you, what's your perspective? Are things getting better or worse?
So I definitely think there are a lot more people seeking help, and the statistics you quoted before were spot on in what I've heard in conferences and from a lot of articles that have been written about addiction and substance use. We have seen a tremendous trend since Obamacare has come out and allowed families to get the help they need for their loved ones with mental health issues or addiction or both. And the amount of centers that have opened up, especially in the teen arena. When I first started in the business, there were very few, especially in California, helping teens. There were a lot of adult places that a lot of you have heard of, Passages, Promises, the ones in Malibu. They've been around for 15, 20, 25 years helping adults, but there were really a few helping the teens. And I think that that's become a lot more available. So the trends are helping with addicts and mental health patients. And the insurance available helped, because it used to be only available for private pay.
So I want to get your perspective. So one of the challenges I see is that because it's only been a few years since we've really had a recognition of addiction treatment as being part of the health benefit, we don't really have robust evidence-based standards. And I think it's very confusing I hear from a lot of both families and treatment providers that it's very confusing, particularly because we have much of our addiction treatment system is abstinence-based, social model, spiritual and social support, which we talk about. But what's coming out of Washington, D.C. is a harm reduction model driven by talk about medication-assisted treatment, putting people on buprenorphine. I'm curious, you're right there. What's your perspective on
Yes.
If you could address sort of how people should think about that tension and those choices and getting good information, that would be helpful.
Yes, I think really and the way that we look at our destinations is that it's an individualized basis. Every single patient, or we call them clients, they don't like to be called patients, but every single client that comes into our facilities gets an individual attention, and understand that we have to provide different modalities for them. It could be what's called DBT, CBT, there's tons of lists that I'm sure the specialists on the panel could really address in terms of the names and what they do. But one of the ones that Harry just mentioned is MAT, or medication-assisted treatment. That is really on the forefront right now. We do not participate in specifically in destinations, but there are a lot of organizations out there today that do. And what that means is they're providing a medication treatment rather than abstinence or 12-step or other programs that have been around for 20, 30, 50 years. And these are new, just coming out in the last couple of years, and I see a tremendous support system working with these MAT programs across the country. And Harry and I were both at a conference in Arizona about a month and a half ago, and one of the key topics was MAT specifically. And I think it's really going to benefit society and help. And you have to understand it's not for everybody, because it is an actual drug that you're taking, but it's taking you away from the addiction of heroin and other opioids.
Thank you. Debbie, if I can get your perspective on this question, are things getting better or are things getting worse? And if you want, I'm curious if you have an opinion on this challenge of how people should think about these choices in terms of what, we'll get that. Anyway.
In terms of actual treatment modalities, I'm not an addiction expert. I would leave it to the two of them. I wouldn't address that. What I will address just is my work is within the Orthodox community, and I get calls from all over the country just based on work I've done and because I've been to so many cities bringing the safety program in. What I'm hearing is more and more and more families calling for help. And I'm finding, and I'd be very interested in if Rabbi Kirchhoff is hearing this saying, that families are calling earlier. I think that people are very frightened by the numbers of suicides. I think people should be frightened by the numbers of suicides. And I think that more and more people are calling earlier and earlier, maybe not early enough, maybe not enough prevention. I don't believe we have enough drug and alcohol prevention in our schools at all. I don't think pornography is being addressed at all. I don't think these things are being addressed at home, and I don't think they're being addressed in school. But it would be from the numbers of calls that I get of parents asking for help, I would say that there is an increase. I'm interested in what Rabbi Kirchhoff has.
I definitely think that panels like this, I watched the trends in New York, also in the tri-state area. There is much more of awareness out there. There's a lot more challenges in the Orthodox community than there's ever been. There's an organization in New York that claims there's been over 150 deaths in the Orthodox community of young people over the last 4 to 6 months. There's definitely a lot more awareness. People talk about it. People talk about mental health, and people talk about drug addiction. The challenges is that, people go in and out of programs. And, when I was working in the treatment programs, you saw people walk in 5, 6, 7 times till they were able to make that decision that they were ready to get to do the work. I can go to the gym 100 times. I can sign up for the gym 10 times, but if I don't do the work, it's not going to help me. So going to treatment center, it's amazing that it's available, and so many people have taken advantage of the Obama, the healthcare system, that they're able to go to programs, but it's really about them being ready to get the help that they need.
I was going to add, by the way, I just want to come back on your suicide comment. This was a statistic that really, I don't think we talked about at all. There was a study, probably the best study that I could find on the question of how much of the overdose death trend that's is suicides. And the best study that I found said roughly 20% of the people who are overdosing on opioids are suicides. About 40% are accidental, and the other 40% we really can't tell. But I think that's a critical piece of the conversation. Rabbi Kirchhoff, let me come back to you. I want to ask you to put you on the spot. How does our tradition inform specifically how we approach this issue? And I one question that's sort of I don't mean this at all facetiously, but I struggle with is the issue of shame came up a lot, right? All the shame that's not being expressed. And I think one of the challenges is we are a culture that thrives on guilt, right? On what we should have done, and I just wonder if you can sort of address how our tradition sees this and how we reconcile the pressure that we put on ourselves structurally in our tradition and this challenge of shame being a driver of this problem.
Jewish people are known to be shameful and to, but we also thank God, God has created for us many closets and many carpets, and that we're able to brush things under the carpet and under the closet, especially when it comes to people dealing with shidduchim for their children and things like that, so we have the ability to, to deny that problems exist. You asked me from a Jewish perspective. There are chuvas, or Moshe speaks about it. He has different opinions. He has a couple different approaches to, but the simple approach, my understanding is that anything that's mind-altering, the difference between a human being and other forms of life is the fact that we have the ability to think. So anything that will take away that ability to think, it becomes something that's not appropriate to do. That could be alcohol, that could be, and again, alcohol is not necessarily any healthier. If anything, I may be wrong, but alcohol is one of the most addicting drugs out there. Nowadays we talk about, opioids, and the dangers of that, but alcohol is just as, just as dangerous. It's been around a lot longer, it's just as dangerous. But as far as, it's interesting that anybody who's involved in the substance abuse community knows about the 12 steps. Again, not everybody doesn't work for everybody, and I tell people all the time, if something else works for you, if you can go to the ocean every day and you can stay clean, power to you, whatever works for you. But the 12 steps, it's interesting that in Judaism, the 12 steps can fit right in. It's basically a Musar sefer about how to accept powerlessness and give over our power to God. It's really, it's Judaism all over it. Some people, Christians will take, they'll take credit for it also. But really, the concepts in the 12 steps are really very Jewish. It's about connecting to something bigger than we are. It's about being spiritual, right? Spirituality. What does spirituality mean? Being spiritual means that we're connected to something bigger than we are, and being part of something, and the mitzvahs that we have are, they're our personal life. We're supposed to connect that. That's how we have a relationship. That's how we have a purpose because of that. We have to find a way in some of the schools, again, not blaming anybody, but to be able to connect our way of life and the mitzvahs we do and figure out a way how to connect that to a higher power. That there is a connection between where it sits us and God taking care of us and being, part of us, being connected. We have this disconnect. I can do mitzvahs, I can keep Shabbos, I can keep kosher, but what does that really have to do with God? Nothing. And so the 12 steps are all about finding a way to connect to God and finding a way to realize that we're powerless over this and need help from a higher power. But we really have that already. We kind of have to work backwards. We have to kind of recreate a more personal relationship with Hashem that enables us to use that relationship to help us function and help us with our challenges, our traumas, our crises, and this is question, the biggest crisis, can you imagine the biggest trauma, crisis I know to deal with? You get to you leave Egypt, and suddenly you get to a dead end, and you got the Egyptians behind you, and you got the ocean in front of you. Is there a greater trauma than that? That's a crisis in my book, but again, the Torah teaches how to relate to that. And so it's about learning how to, you don't have to use the 12-step, but it's about learning how to connect religion to our day-to-day lives. It's something that if we can try and incorporate in schools, we don't have to go elsewhere to find that. We have it within us already.
Debbie, any thoughts about how our tradition informs your work and prevention?
So I want to address it a little bit similar to some of what Rabbi Hershoff brought up. What happens is victims end up feeling such shame that they can't express themselves and they can't talk. And nobody opens that door for them. Adults aren't asking them. And really the ones who should be feeling the shame are the predators, not the victims. And yet, we've got a whole generation of people who have been, generations of people who have been victimized, who are victims, who can't talk because of their shame. And I think that shame and stigma, we have to take it, each one of us, Each one of us has to be able to look at these things and try and make a difference, not to allow stigma to affect us. That if a neighbor says that their child's going into a treatment program, that our feeling is how wonderful that he's getting there. Is there anything I can do to help? And not walking around, turning around and saying, oh my gosh, did you hear about their kid? Because that is what we end up doing in our community. We have to take the stigma away, and I think that we can do that. We have to provide opportunities for kids to speak, but we have to do that as a community, one by one, where we really stand for the mental health of each one of our children and each one of our friends, that we're going to stand up for that. I think that it's just very important that we do that. I also think that each one of us has to be able to go into our children's schools and say, we need there to be education and prevention programs, especially for these high school kids. If we don't each stand up for our children, if we don't advocate for our children, the schools can get away without doing it, and all the kids are trying to get in, they don't have to. Our kids are using and they don't know anything about it. And in every school. So I think that it is really important that one by one we empower ourselves to make a difference. The world isn't going to be different. The community isn't going to be different. We have to make a difference.
I'm curious, Diana, you have thoughts about that. I'm interested too, but just sort of two issues that, from things you said earlier that I'm curious about. One, you made a comment about that if you have one l'chaim, that's not a problem. If you have 5 or 6, so what we observe a lot. I observe practically every Shabbat in this community, people overindulge. I'm just curious, what if you think that's something that I'm curious if you have suggestions about that. And the other question that's been rattling for me in the last couple answers is in our schools. We tend to think of our schools as being a little more sheltered. My son told me tonight that he was involved in an incident with drinking a couple months ago, and a younger student came up today and asked him for cannabis. Right? And we're living in this time with all the marijuana decriminalization in the state. I'm curious to get your thought on how do we respond to it, and any suggestions of being involved in treatment.
So I think as an Orthodox Jewish person and someone who belongs to Beth Jacob specifically and other schools in the area, and I see what happens every Shabbos in this community, and living in New York for many years, witnessed something at the Young Israel Woodmere becoming a dry shul. I'm not saying I'm an advocate that all schools should be dry. I'm just saying that that's something that can help in this area. One of the reasons that Young Israel Woodmere became a dry shul about 15 years ago now is because they had a child about 11 or 12 years old join his father at a Kiddush club in the shul, partaking in the Kiddush club, and all of the men around the Kiddush club stating, come on, have one l'chaim, and he kept going and going and going, and before you know it, he had alcohol poisoning, was rushed to the hospital and almost died. And because of that, they decided to have, greater discussions on the board, and within a year, they abolished the Kiddush Club at Young Israel Woodmere. Again, I'm not necessarily saying that we should do that in every shul, but I think that's part of the problem. You look at Pesach, you have 4 cups of wine, and everybody says you have to drink the wine. We're pushing it as a religion to drink. You have to make Kiddush Friday night. You have to make Kiddush Shabbos morning. So all of these things are seen by children. And if they have a mental illness already, and they're seeing this, and they say, okay, I'm going to try one, they can't stop, because they have that addiction component in their genes. And it's important for all of us to realize and communicate, and I'll piggyback on what both of you have said already, that communication, not only within our community and destigmatizing addiction in the community, but it's communicating with your individual kids and have open discussions. There's nothing wrong with having an open, honest discussion with your family member. It's really critical, and we really push that within our programs that all families must participate in. it's important to have those conversations. If you see something, if you don't see something, have the conversation. If they see a friend that's in need, how they can help them. And that's what we really have to do as a community and as a religious community here in Los Angeles. I will also state we have gone into many of the high schools here in Los Angeles, and I participated, I believe Rabbi Hershoff was talking about Amudim as the program in New York. I participated in a couple of conversations with Amudim and participated in a panel. I wasn't on the panel, but I was there to listen to the panelists. And they had where was it? It was Lawrence Cedars. They had, it was Lawrence Cedars, no, it was Beth Shalom, had about 250 people one weeknight participating in this event to become aware. It was addiction awareness in our community, and that was the title. And I think that it's important that we have a nice group here tonight, but instead of everybody would really go out and talk about it and say that we need to deal with this within our community. I think that's really where we're going to start seeing the change.
So I wanted to just, we're coming close to 8:30, and I wanted to give each person on the panel a chance to say, to leave us with a final takeaway. We're going to have, because we thought the suggestion from Rabbi Posey was that if the panelists will stay up here, that the topics tonight might be better for one-on-one conversations afterwards. So, but before we sort of conclude, I just wanted to come up front and say and ask if you had a final takeaway for us tonight, what would it be?
So I think, Donnie said most of it before, but I think it's our perspective of people when we see people. I mean, I try to teach the kids around me, when you go outside, you see homeless people, a lot of the kids, the young kids in the community, they make fun of them, it's similar, with mental health problems also. I think that we need to learn to look at people that are sick and teach that to our children that they're sick like any other sickness. They're sick. They have a sickness. Torah views them as sick, and the Torah says force nefesh and force haguf, It's a force nefesh. That's a real thing. It's a real thing, and they're not just crazy, and it's not their fault, people use, people self-medicate, in many ways. Okay, is it their fault they started? Maybe they took something to self-medicate, they were in pain for something that happened, or because of a mental health issue. Okay, so you want to blame them, but we have such a negative view of, people that use substance abusers. We blame them. They're horrible people. There was a boy that I worked with a few years back, and he was abused as a young person, and it was so eye-opening to me when I watched him. He could not get clean. He subsequently passed away. But he could not, every time he got clean for more than a couple of months, he would sabotage and overdose every single time. And I watched him, and the pain that he lived with from the events that happened to him as a young person, he could not live with himself. He was not capable of living with himself as a sober individual. So he had to self-medicate. So that's just one example. But, people that suffer from mental health issues, they live with, they have OCD, or they have, we have to learn to give it the proper respect that it deserves. And teach our children, teach the community this. They're sick. It's sad for them, they're sick. Let's treat them, let's talk to them. Let's not run away from them like they're bad people, horrible people, diseased people. You wouldn't treat that way a family member or somebody in the neighborhood if their kid was sick, God forbid, or if somebody was sick or was in an accident or something. You wouldn't treat them. You'd go over to them, you bring them food. If the neighbor was sick, or somebody, there was a tragedy or something, you would treat them. You bring food over. But when someone with a mental health issue or an addiction, suddenly it's like, just stay away. Maybe it's their fault, they shouldn't have got involved. It's really, addiction is just a symptom of a deeper issue that's underlying everything. That really touches the core of a person. And until he gets help, he or she gets help for that, there's not a lot that we can, there's no way to and I use an example, but, if I'm in pain and I take aspirins, if I take away the aspirins, what happens to you? You're still in pain. So, that's kind of how we have to view people that are addicts and people that suffer from mental health. Thank you for coming.
Debbie, can I ask for your last word then?
I'd say walk out of here and make a difference. Do something different. The very first thing I would just say is for those who have children or family members, be siblings or whatever, open up the lines of communication. If someone is suffering, they can't open it up with you. If you want them to talk to you, you have to model opening the conversation. I was incredibly impressed that your son came over and said that somebody came to him and asked for cannabis. I can ask Rabbi Herschel, how many kids have that experience a day? And how many go home and tell their parent? That's a sign of a parent who has communicated with the child, that a child feels comfortable coming to you and saying that. It's happening in every school. Are they coming home and telling you things like that? And so I just say, just communicate your love, communicate with your children, advocate. Don't be afraid to stand up and advocate, make a difference. And I think what Rabbi Herschel said before about spirituality, I think we've become a religion that keeps to the 613 commandments, but we don't have love. We don't have spirituality, and we don't teach that to our children. We teach them the rules, but we don't necessarily teach them the love with God, and I think we have to bring all of that in.
Okay, I guess I'll continue. I mean, both of you said some really important things and continue what I had mentioned in terms of communication, opening those lines and with everybody in the community and with your loved ones. I think that really is critical. And the other thing is to realize that there are places to get help from all three of us. It is important to understand that there are outpatient facilities, there are walk-in centers, and organizations like Debbie's who can really help all types of family issues that come up. And that's really going to help destigmatize it, is getting that help, getting it out there in the public. At Destinations, we have literally helped a child from every single, whether it's secular or religious school, Jewish school in this community. Every single one of them. So, without exception. So it's important to understand that it has affected everybody, and that those seeking the help have it here available, and it's important to get it. And it's what goes with the adults as well. There are a lot of centers that can help on the outpatient side or inpatient, and that's really what I would take away from this.
So, I guess the virtue of being the moderator, I get the closing word. I just wanted to say two things. On a personal level, it's interesting. I'm struck that even as we have this conversation, one of the enormous challenges is that even within the conversation, and I see this in the addiction world, there's still layers of shame in the thing itself, right? I was at a meeting in Washington, D.C., and I was speaking, I used the word addict, and the president of the AMA corrected me and said, we try to use person-centered language now and not say addict, say a person seeking recovery, a person struggling with addiction, and I think that we have a lot of work to do in terms of thinking about how we talk to our kids. I constantly find myself trying to find ways to be as vulnerable as I can possibly be with my kids and my work, with the people in my office, and to share that we're all dealing with these issues and really to normalize them, because to me the lesson that's come out of the work that I've been doing this last 15, 20 years in the area has been that the most inspiring people I know, the truly heroic people I know, are the people who have lived with this challenge and have found the way back. And I think we need to go from thinking about this only as just a problem, to really recognizing the heroism of so many people. And the last thing I just wanted to share, just as a matter of perspective, is I think we're living in a time when things are changing so quickly in terms of what we understand about the science, in terms of what we understand about effective treatment, and that I would strongly encourage. One of the things I've seen is, again, even going into senior levels of the policy conversation, is that there's enormous confusion about how to address all of these problems. And so that I think I would encourage anybody who's trying to figure out what the right resource for their family, for their child is, to really do research and to get multiple opinions, and to not just take any one opinion, because I think that we're living in a time when the whole conversation is changing. But I really want to thank the three of you for sharing, and I hope that I do think conversations like this are, as you said, Debbie, are really hopefully a starting point for really taking this conversation into more spaces and making more room for it. And I'll leave. I was struck. It's dangerous to start talking about Torah next to a rabbi, but about Moses, it says Vayigdal Hayeled, that he grew up, and the first thing it says is Vayitzel Elacham. He went out to his brothers, Vayar et Zivlotam, and he saw their pain, and really I think that a lot of what we're talking about tonight is those two things: is coming out and actually being together, making space to talk about these things, and seeing the pain in the community, and being able to empathize and connect around it. So with that, I'm going to turn the mic over to Rabbi Posey. Thank everybody for coming out. And as I said, I think our panelists will stick around and share and be willing to talk to anybody. Rabbi Posey.